Tennis elbow versus golfer's elbow. What's the difference? Tennis elbow and golfer's elbow are really just the same thing, just on opposite sides of the elbow. I'm Dr. Dave Candy, and in this video, I'm going to tell you about what tennis elbow is, what golfer's elbow is, and some tips on how you can play tennis and how you can play golf without tennis elbow or golfer's elbow. Now, truly, you don't have to play either tennis or golf to get tennis elbow and golfer's elbow, and tennis players can get golfer's elbow, and vice versa, golfers can get tennis elbow. But really, more commonly, tennis elbow and golfer's elbow come in office workers and other people who do repetitive activities with their hands. But in this particular video, we're going to be talking about tennis elbow and golfer's elbow from actually doing sporting activities like tennis and like golf. Now, if you do find this video helpful, give it a like and subscribe to our channel. We help people stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. So first, we're going to talk about tennis elbow, which is pain on the outside of your elbow. It's otherwise known as lateral epicondylitis, meaning inflammation of the bone on the outside of the elbow. But since lateral epicondyle pain is usually not inflammatory, it's usually from an overuse injury, it's also referred to as lateral epicondylalgia, meaning pain on the outside of the elbow. But where does that pain come from? Well, that pain when you're playing tennis often comes from either the impact force of hitting a backhand when the ball hits your racket, and you not only have to keep it from blowing you back that way, but you have to stop it, reverse the direction, and then hit it back the other direction. And so you get the compound force of the ball coming in this way as well as trying to reverse that direction. And that creates a lot of vibration through the springs, which then it's transmitted through your forearm and up into eventually your elbow, where your wrist extensor muscles attach. Now, what actually causes lateral epicondyle pain is the wrist extensor muscles. You can see when I move my wrist like that, the muscles that attach to the elbow, they kind of move. Likewise, when I supinate or turn my wrist like that, the muscles that attach to the outside of the elbow also get used. And so tennis elbow in playing tennis often comes from overusing those muscles when hitting a backhand. Now, it can also come from hitting a topspin forehand where you're overstretching those muscles really quickly, or a topspin serve where you're overstretching those muscles really quickly. But most tennis players will report having tennis elbow more commonly when hitting a backhand. So how do you hit your backhand more effectively without having tennis elbow? Well, a lot of the problem, whether you're hitting a forehand or whether you're hitting a backhand, comes before you actually make contact with the ball. You have to have your feet in the right place and be positioned well for your shot. Because if you're reaching for your forehand or reaching for your backhand, then you're going to have to just hit it with the force of your forearm. You're going to have to take all that impact force and vibration produced by the ball with your forearm and just kind of absorb that shock. And what actually happens at the moment you make contact is your racket goes just very slightly back in that direction, and then it stops the ball, and then you use your arm to hit through. So there's a very momentary eccentric force where your muscle is trying to produce an action that way, but the force coming upon it is reversing that direction. And eccentric contractions can create a lot of damage to muscles and to tendons because you're tightening or contracting or trying to shorten that muscle at the same time as it's actually being lengthened. And so that can tear muscle fibers and injure the tendon that attaches to the outside of the elbow. So the best way to stop that from happening is to position yourself before you hit your shot and be in a position where you can use your body to create the force, where you can start to create that with your hips and your trunk and then your shoulders. And then finally, if you're going to put any spin on the ball, then your forearm and hand come in at the bottom, at the back end of that. But if you're just hitting your backhand, kind of blocking the ball, you get all that force absorbed through your elbow and through your forearm. So being in the right position and setting up your shot correctly is really important to make sure that you don't get too much impact force at your elbow when hitting a backhand. Now, at the same time, if you are set up correctly and you get everything set up right, and you swing and you stop, you're still getting a lot of that force ending up in your elbow. And if you watch pros play, they don't usually just stop right there in their swing. They usually follow through and they're in to hit their next shot. So when you are hitting your backhand, you're going to make sure you don't just stop at contact with the ball, but that you follow through and swing and get back to ready position so you're ready to hit your next shot. Now the same principles apply to your forearm, and then we won't go specifically through those. You want to be in the right position and you want to follow through your shot when hitting a forehand as well. So that's tennis elbow. Now if you do have to hit a backhand or a volley where you're just suddenly kind of hitting a slice, or you have to reach because your opponent hit a good shot and you just need to block the ball somehow, that does happen when you're playing. And so finding things to help absorb that shock, be it the right type of racket frame that'll help absorb the shock, the strings, the dampeners inside the strings, or wearing something externally. A lot of people have seen the tennis elbow braces that sit right here, and they just kind of clamp down on your tendon. And what they try to do is keep all that force from going to the tendon. But by the time that force has traveled up your forearm muscles have already done the contraction, and they're still going to pull on the tendon. So most of the time, those tennis elbow braces don't work for people who actually play tennis. Now, if you're just working an office job and you have some low impact forces of your forearm just typing repetitively, those can work okay for that type of tennis elbow. But if you are playing a high impact sport where you're hitting a ball with high impact, then something to help absorb that shot can be helpful. And that's what I'm wearing here. It's a brace by TENEX. It's called an elbow shock absorber. And you actually wear it on your wrist close to the point of impact so that it absorbs the shock before it goes up to your elbow. So those are the tips for tennis elbow. Now, what about for golfer's elbow? Well, golfer's elbow is pain on the inside of the elbow, or medial epicondylalgia, or medial epicondylitis if it's inflamed. Now that happens in golfers if you're hitting, it'll happen on your trail arm because you're using the flexor pronator group in your forearm. When you use that flexor pronator group in your forearm and you're following through, particularly if you're trying to create a lot of club head speed and you're using your forearm quite a bit, that can create golfer's elbow. Now, interestingly, golfers often get tennis elbow on their front arm because at the same time that you're flexing your back arm, you're also kind of extending your front arm, particularly again if you're trying to get those last degrees of club head speed by breaking your wrist right before you make contact with the ball. So how do you stop golfer's elbow? Well, again, a lot of the tips are very similar to the way that you stop tennis elbow. Now, obviously, you're not running up to the ball and getting in the right position, but setting up your shot appropriately helps. You want to have your front foot turned out a little bit so that you can follow through the ball. That the more your foot is lined up parallel in this direction, it is going to stop your follow through to some extent. Versus if you can turn it out just a few degrees even, that gives your hips some more room to get through at the end of your shot and not absorb so much of that shot at the point you impact. You can actually hit through the ball. The next point is winding up appropriately in your backswing. That when you are winding up, you want to make sure you wind your body tight like a spring. And you want to get everything wound up so that when you're unwinding, that you've already got a lot of momentum built up before you actually break your wrists. If you're trying to hit exclusively with your shoulders or hit exclusively with your wrists and forearms, that's going to create a lot more impact with the ball. And again, having something that you can use to help absorb shock, either like a graphite shaft on your club, where it's going to bend a little bit and it's going to create some of that speed just from the engineering of the club, or something that you wear externally on your body, can help to absorb the shock when you're golfing. Now, what about exercises that you can do to help tennis elbow or golfer's elbow from high impact sports like golf or from tennis? And again, we're not talking body collision high impact, we're talking high impact with a fast moving object. So things you can do muscle wise, the most common thing that people do for a sore muscle is they try to stretch it. But when you have an eccentric contraction of the muscle, where the muscle is trying to contract at the same time as it's being stretched, that actually creates micro tears within the muscle. And if that muscle is already torn and you're trying to stretch it even further, sometimes that can create more problems within the muscle. We're actually stretching or tearing a muscle that's already overstretched or torn. So you don't necessarily want to do that. Instead, you want to recondition that tendon by doing high repetition exercises. So for tennis elbow, extensor problems, high repetitions of wrist extension with no weight or very little weight. So it's more of like an aerobic exercise for your forearm muscles. Now, additionally, what do you want to do for golfer's elbow? Again, just the opposite of that. You want to do your flexion with your forearm, where you're using the muscles that are attaching to the forearm there. So now what other muscle exercises can you do? Well, although you may have tears in certain parts of the tendon or certain parts of the muscles, there are parts of the muscle that might be stiff. So using a tennis ball or a golf ball or whatever you have and kind of rolling it around on the parts of the muscle that actually aren't that sore but may have knots in it is a good thing that you can do to help either tennis elbow on the top of the arm or golfer's elbow on the bottom of the arm. So hopefully you did find those tips helpful. Now, if you do want to get back to playing tennis or get back to playing golf, and you happen to be in the St. Louis area, we'd love to help you out at my clinic here in More for Life. And if you're watching this from somewhere else in the world, but you did find the tips helpful, give the video a like and subscribe to our channel so you can get notified when we post more helpful videos. Thanks so much for watching, and have a great day.